What really happened was that we didn't start as a department. It was started as a division in the Department of Public Health Administration for international health. And so it had a very clear focus then on how do you work within the systems, economic, political, everything else, when you go overseas. And so right away, we were facing a set of problems for our research that was very different from what anybody else was doing. One of the first things we did was to try to find out who else was trying to do this. There was no one, as far as we could find out, except people at, for instance, in London, at the School of Tropical Medicine there. They had departments where they were doing this as part of tropical medicine. But we found that there was nowhere else that anybody was trying to do the specialty of how do you do international health with all of its complexity, but also with the basic principle being that we've got to learn somehow not to go into countries thinking that we're just taking the best of what we have in the US and giving it to them as a gift, because it doesn't work that way. And even then, people who were trying to do that realized it was not working. That's why AID asked for people who could specialize in how can you develop a total program that begins to train leaders who understand how to work in conditions with all of the diversity of the health problems and the health care problems and the financing problems and different political systems that we have to deal with internationally. And it was a great opportunity then to do that at a time when the international agencies were just beginning to develop an understanding of this is something different from what we've just been doing in taking the best medical care around the world. We've got to learn how to start from the beginning. And that takes a whole new skills and understanding in order to develop the research. And that's why I ended up at Hopkins, because it sounded like a wonderful challenge to be able to really focus on how do you develop people to be specialists in working on the conditions of the poor people of the world.